Now we continue with the back transporting points, bladder 28, the Bladder'S. For the location, bladder 28 is 1.5 June lateral to the posterior midline on the level of the second sacral foramen. How to find? The quick method: locate the posterior superior iliac spine, the PCs, from the rima ani. Palpate 3 June, 1 hand breadth in a superior and lateral direction at a 45 degrees angle until you feel a distinct bony ridge, often superficially visible by a dimple. Bladder 28 is located slightly inferiorly and medially to the PCs. 1.5 June lateral to the midline on the level of the second sacral foramen. For more detail on orientation in the lumbar and sacral region. Located at the same level are bladder 32 over the second sacral foramen and bladder 53, 3 June lateral to the midline. Bladder 27 is located slightly superiorly and medially to the PCs on the level of the first sacral foramen. Needling, bladder 28 is done vertically 0.5 to 1.5 June. For local disorders, slightly oblique insertion towards the iliosacral joint. For the action indication, bladder 28 regulates the bladder and the lower burner, clears damp heat from the lower burner, removes stagnation, and transforms masses. Benefits the lumbar region and the legs. For the special features, bladder 28 is the Back-Shu point of the bladder. Bladder 28 is very much used in urinary disorders. Firstly, it expels dampness from the bladder and the lower burner, and it can therefore treat retention of urine, difficult urination, and cloudy urine. It also clears heat from the bladder and can be used for painful and burning urination. Combined with bladder 23 and spleen 9, it is used to expel renal stones. Bladder 28 also generally opens the water passages of the lower burner and ensures that the dirty fluids are transformed and excreted. It is a point that is often combined with bladder 20 to transform fluids in the lower burner and promote diuresis. Combined with bladder 23, it strengthens the lower back and is specially used for pain in the buttocks and sciatica. So for the summary, it regulates the bladder for difficult urination, dark urine, retention of urine, enuresis, and turbid urine. It also resolves dampness in the lower burner, those having swelling of the external genitalia, ulcers on the genitals, itching in the genitals, swelling, and pain of the vagina, swelling of penis. It also eliminates stagnation and dissolves masses for those having abdominal pain, abdominal masses, constipation. It also opens water passages in the lower burner. It strengthens the lower back, those having stiffness and pain of the sacrum, lower backache, stiffness of the lower back, pain in the buttocks, numbness of the legs, and sciatica. Bladder 28 is the Back-Shu point of the bladder, where the chi of the bladder emanates from the interior to the body surface. Its principal action is to drain damp heat excess from the bladder and genital system. The bladder damp heat may be due to invasion of exterior pathogenic factors, damp heat or cold damp, which transforms to heat, especially as a result of inadequate clothing or sitting on a damp ground. Excessive consumption of foods that generate damp heat, like spicy, greasy, sweet, alcohol, etc. Heart fire, which transmits downward via the small intestine to the bladder, liver damp heat, which pours downward to the bladder, and excessive sexual activity or inadequate hygiene. Bladder damp heat typically manifests as painful, difficult, hesitant, and frequent urination with scanty dark flow. As the bladder Back-Shu point, bladder 28 has a direct action on the bladder Fu and is not only a vital point to drain bladder damp heat, but is more widely used for any kind of urinary disorders. The use of bladder 28 is not confined to the bladder, however. It is an important treatment principle of Chinese medicine that damp heat anywhere in the body, and most especially in the lower jaw, in draining via urination. Bladder 28, by its action of promoting urination, is therefore indicated for damp heat affecting the intestinal region, giving rise to diarrhea, and the genital region, giving rise to such symptoms as swelling and pain of the external genitals, genital ulceration, and damp itching, swelling, and pain of the vagina, etc. The second important action of bladder 28 is in the treatment of a variety of disorders of the lumbar region, sacral, buttocks, and coccyx, as well as the lower limb. And it may equally be used for excess or deficient disorders of these regions. It is classically indicated for the treatment of wind taxation lumbar pain. For a fuller discussion, okay, see the bladder 26, as well as for weakness of the leg and knee, seminal emission, and diminished chi. These indications reflect the fact that as the Back-Shu point of the bladder, bladder 28 has some action of strengthening the kidneys as far as excess disorders of the lumbar region and legs are concerned. It is specially indicated for back pain, atrophy disorders, and heaviness of the legs due to damp heat. Finally, bladder 28 is able to resolve stagnation in the lower abdomen, abdominal pain, difficult defecation, constipation, abdominal fullness, and to resolve abdominal masses in women as well as hard abdominal masses.